Good evening, I'm Dr. Kenny Levine with Health Talk. Health Talk is seen on WEYW19.com and Uverse Channel 19. I am a dentist, I'm a periodontist, but this show is not about dentistry. Actually, this show is about wellness from the top of your head down to the bottom of your feet and all points in between. In our practice, we treat patients from 3 days old up to 100 years young. But we're not here to talk about my practice tonight. We're here to talk about a very unique situation. I'm here with a gentleman. When I first heard his story, I thought he was a urologist, but I was wrong. Dr. Herb Ross, thank you. Welcome.
Very nice to meet you.
So tell us a little bit about your background, where you're from and your education and how you got to where you are today.
I'm originally from New York City.
Uh-huh.
I am a holistic chiropractor.
Okay.
I have licenses in Florida and Colorado. We established ourselves in Colorado because I wanted to have a holistic practice, and I always believed that it had to combine the structural, the nutritional, and emotional to get the result I wanted with my patients.
Let me interrupt just for a second. Give me a definition of a holistic chiropractor as compared to a chiropractor.
Well, a chiropractor concerns itself primarily with manipulating the spine and other joints. A holistic chiropractor has a holistic view, which embraces nutrition, which is very important, and emotional and mental things that keep people in pain and discomfort. So my intention was to hit as many bases as I possibly can to get the best achievable result.
So your educational background was at a chiropractic school.
Correct.
And then what happened after that?
Well, after that I practiced here in Miami, Florida for, 20 or 30 years.
Right.
And then a couple of steps along the way, and we ended up in Colorado, in Aspen.
Uh-huh.
And I had a long abiding interest in sleep. So I authored 2 books on sleep disorders and established the Aspen Sleep Clinic, whose purpose was to train people how to sleep in a natural way without drugs or surgery or any other devices. No drugs.
Well, I've been to Aspen a lot of times, and probably after you were there, and I had no trouble sleeping out there because it was a beautiful place to be.
Sure.
But I would say that sleeping in Aspen is different than sleeping in the middle of New York City.
Well, it's different in a way, but people who live in Aspen become acclimated to the height, the elevation, and essentially it's the same problem. 50 to 60, maybe 70% of the people have trouble sleeping, need to take medications to sleep.
Right.
And as a result of that, they suffer with immune system problems, which can lead to, as you probably know, all sorts of disorders, from cancer to cardio problems to
just because they're not getting enough rest.
Yes, the immune system is the system that keeps us healthy. As a matter of fact, they're now saying, which I've said for years, that people are constantly cancering. It's really a verb, not a sentence. And if your immune system is working properly, it handles that cancering as it comes up. It's when that immune system fails that the cancer begins to win the battle.
Yeah, from what I understand, everybody's got some cancer cells somewhere in their body, and eventually they either take over or you defeat it.
And the immune system is the arm of the defeator.
Now, you talked about not sleeping well, and we're going to get to what you do, because one of the reasons people don't sleep well when they get older is because they're getting up to go to the bathroom in the middle of the night.
Exactly.
How's that for a segue?
Great segue.
Okay, so let's talk about it.
So we discovered that our patients, both male and female, were getting up 3, 4, 5 times a night to go to the bathroom.
Let me interrupt you for a second, because I'm aware of an enlarged prostate for men that would cause this. What causes it in women?
What causes it in women is weak pelvic floor muscles,
okay,
which interferes with them in terms of urination and bowel control.
Okay.
So if you have strong pelvic floor muscles, those valves that control those areas are strong and work all the time.
And that would be the same thing for men sometimes, not only the prostate.
And for men as well. And usually following pregnancy, women will have vaginal prolapses.
Right.
And those are the things that lead to sexual difficulties, painful sex, as well as back problems, and urgency, urinary urgency, that keeps them running to the bathroom almost all the time. So as a holistic doc, I was interested in what could I use to help these people without drugs to allow them to sleep better. So I researched it. This was almost 20 years ago.
Well, let me interrupt you 1 second because we need to take a commercial break.
Right.
It's Dr. Kenneth Levine with Health Talk. We'll be back with Dr. Ross in just a moment. See you in a minute. Thank you.